So we've been also discussing today the possibility of having Farokh Master come down to Australia and do some teaching with you. I'd like to basically ask Farokh a little bit about what his passions are in teaching, and then you, Alastair, what your passions are, as we've just heard, of course, some of them, and see how what you guys propose to do as a teaching effort down in Australia, and so that we could see how we could basically accomplish some of the objectives you just mentioned about having students maybe have developed their critical thinking skills, their abilities to have experience with the remedies, understand the patients more. So Farokh, now that you've listened to what Alastair's been saying, and based upon your experience and the work you're doing here in Holland at the moment, what sort of things would you like to bring to Australia?
Dale, I would like to teach in Australia. Number one is the art of observation in acute and chronic conditions, especially the principle of observations. Once you observe something, how will you put it down on a piece of paper and try to integrate the language of the patient into language of the repertory, the case analysis. I would also like to do a lot of study on the acute conditions, especially in those acute life-threatening conditions where the skill of the homeopathic doctor has to be much sharpened. I would also like to do some advanced pathological cases. I would like to do some Jungian stuff also, like interpretation of a mind, especially of a child, of a interpretation of the emotions of a pregnant mother. And I would like to talk more about the serpents, that is the snakes and homeopathy, for which I have just finished writing the book. These are some of the areas which I'll be very keen to talk on.
Fantastic.
Yeah.
And so, Alastair, how do you see 2-day or a 3 or 4-day clinical experience happening with Farokh? What's your objectives after listening to what you had just to say? How do you see this happening? And why should people come? That's basically the question. What's the added value to a practitioner or a student to come to this event?
Well, the added value, I mean, the most obvious value is that in Australia there are not many visible medical homeopaths that have access to the kinds of pathologies and situations you were speaking of. And so there's immediate value in that, in folks showing up, because they're going to, and it's not that it doesn't happen in our professional homeopathic practices. It's that I don't see, my practice is my practice, but I don't see that number, the weight of numbers of those types of pathologies that we're talking about. So there's immediate value in that. And there's something about, there's something about expert clinicians. You've got to come and hear those gems and stories and be inspired as well, and just see the biological action of that homeopathic remedy nailing cases. That's very important. For me, when I hear that, I have not so much a Jungian background, but I trained in a bit of Gestalt, and there's always a little part of me that's interested in the therapeutic relationship between the patient and the practitioner, and so there's immediate interest there for me as well. And I have a suspicion that we have moved away from a sophisticated use of using the mind in homeopathy. We assume that if you use the mind in homeopathy, you must be a Bombay school prescriber, which is of course not the case. And so sometimes that's neglected, and I think we could turn it into a 3-week seminar. We could get some mileage out of that. Sounds good.